want to know, are they protected right now? Can we let them go run around outside? We'll do that. And then just a reminder, we only want to test exposed or at-risk animals. There's no use in testing infected animals because we expect them to have a titer. That's what their body is doing. They're infected, they're going to make antibodies to fight the disease. But how do we know if they're infected? We're going to go ahead and pair our titer with a quantitative PCR. So what that looks like for our program is you take swabs from the dog. So if we're doing distemper or strep, well, I'll just say distemper, you're going to swab their nose and their throat, and you're going to draw blood. You send it all together, we run the PCR, and any of the PCRs that are negative, meaning we don't have the disease, then we're going to run a titer. We save the money and don't run the titers until we have the PCR results because there's no use running a titer on a PCR positive dog. Okay. How's this all feeling? Does it feel like a little too much, or is it making sense? It's okay. Getting some nods. Okay. I'm going to go through just kind of like a cheat sheet of this is how we would manage an outbreak if it came to us. Okay. So rule number 1, confirm the diagnosis. So very often we will get a call that we have something, some disease. Ringworm is a great example. We'll often say we have ringworm. We'll say, how do you know that you have ringworm? And they say, well, the plate turned red. And next hour, I'm gonna bang into your heads that that is not the way you diagnose ringworm, okay? Just because the plate turned red doesn't mean it's ringworm. So we want to be sure we've got the correct diagnosis of what people are worried about for an outbreak. So for distemper, we're looking for that quantitative PCR. Influenza, PCR, and consistent signs in the population. Has anyone had influenza in their shelter? It's okay. It's okay, you're not alone. You might feel like you're alone in this room, but you're not alone. It's okay. So influenza looks like you come in one day and some dogs are coughing. And then the next day, twice as many are coughing. And then the next day, 3 times. And then by the end of the week, every dog is coughing, unless you have some, like maybe separate buildings as part of your shelter. We talk about it going through the shelter like a wave, like it gets everybody. It's aerosolized. The vaccine, don't bother with the vaccine. It is like, it's like the COVID vaccine, and I'm not saying don't bother with that, but I'm saying it will not prevent you from getting sick, but it might prevent you from getting really, really sick, right? So we have had a shelter, well, so that's one reason not to do it. Second reason, it's very expensive. Third reason is that it requires 2 vaccines 2 weeks apart, and the dog's not immunized until more than a week after the second vaccine. So we're talking a really long time. So hopefully dogs aren't staying in the shelter for a month and then getting flu, but we worked with a shelter that every dog in the shelter was vaccinated and immunized at that point for canine influenza, because it was more of like they just had a really long length of stay, this shelter, almost more like a sanctuary. Flu came in, every single dog got it. They were all vaccinated, they all got it. They just didn't get as sick, but they still needed care and treatment, and so save your resources, and we're not fans of the flu vaccine. But that is something where someone says, this is a great example of not just trusting your test result only, right? So we get people who call, we say, we have canine influenza, we got a positive on a PCR panel, a respiratory panel, and we've got canine influenza. And then we talk to them, and they maybe have 3 coughing dogs out of 50, and the positive was a week ago. We're like, false positive. That's not canine influenza, that's not what it looks like. So you've got to take all of the information together. Parvo panleuk, the point of care test is really helpful, but you do keep that in mind with your clinical signs. Ringworm we're going to talk about next hour. Okay, the next step after you've got a diagnosis, we're going to assess the risk. We're going to look at the individual case. How was it diagnosed? Was it a quantitative test? What lab was it done through? Where did the animal come from? Was it local? So the risk of distemper, for example, is kind of low if it's a stray animal that came from a community that doesn't really have distemper. I start like, well, maybe it's something else. Maybe that distemper result is from vaccination, right? So we're gonna put all the little pieces together. We've got an outbreak. We want to know, when did it seem like it started? Is this something that's been going on for 6 months, or is it last week? Was there necropsy done if any animals died? And that's something I'll also say. We very often hear an animal died, then they call for help. The animal's been disposed of. We can run necropsies. We can cover the cost of those for you. They are expensive. We can run them through the Wisconsin Veterinary Diagnostic Lab, and a necropsy can be a really great way to get an answer. So save the animal. What's the shelter doing? What response has been done so far? We think about decreased risk of spread if these things are happening. And so conversely, if the opposite of any of this is true, those are the red flags. I'm talking with a shelter and they're like, yeah, we're full, portals are closed, or they'll say, well, we don't vaccinate an animal if they appear to be owned, instead of vaccinating everybody on intake. Co-housing animals, like we were full, so we had to put unrelated dogs together. We're using whatever Walmart disinfectant I could find instead of something that we know is parvovirus. No daily monitoring, that's another thing that gets tricky, but if you're doing all of these things, then you're gonna have a much lower risk of having an outbreak. If the timeline tells us that the animal was probably infected before they came to the shelter, that's our best news ever, and we're gonna talk about how we know that next. Okay, so we are gonna suspect that the animal got the disease, and this is what you're not gonna learn in the book, okay? This is different than what's in the book, or probably online. Shelter-acquired disease, so parvo and panleuk, we're usually seeing that within 3 to 4 days of exposure. What you will read online, or in a textbook, is that the incubation period is 14 days. And so people think, well, if it happened on day 13 or day 10, then it's probably not from the shelter, they probably came in with it, and that's not true. So if you have a dog or a cat that breaks with parvo or panleuk, anytime after day 4 from intake, you need to look closely at whether or not that animal got it in the shelter, okay? And this is not to make people feel bad, but it's the way to check in and see, this is the way you can prevent an outbreak. If you can find an animal that their timeline shows you that they got the disease in the shelter, then you can figure out how to fix it so it doesn't happen and spread to others. Distemper, approximately a week. Ringworm, we're looking at 2 weeks. Okay, we are also, during our outbreak investigation, we want to know how many animals you have, right? Because remember, one of our red flags is being above your capacity for care. So I want to know how many animals are in the building, how many of those are under 5 months, because we know puppies and kittens are at risk, higher risk. how many of those animals are sick? Okay, so if you've got 40 dogs in the building and only 3 of them are sick with respiratory disease, I'm much less worried than if it's 20 of them are sick. Or if you've got 40 dogs and 30 of them are puppies, then I'm like, oh gosh. And that is because our vaccines, look, puppies and kittens are wild cards when it comes to vaccines. The number of vaccines doesn't matter. It's all about maternal antibodies and whether or not that vaccine was able to get through any maternal antibodies that were present at the time and actually immunize the animal. So I always consider puppy or kitten under 5 months of age, regardless of vaccination status, as at risk. We want to know what your vaccination protocols are like, right? So are you vaccinating everyone on intake? And I mean everyone, including pregnant, nursing, little babies, if they're sick. So the only animals that shouldn't be vaccinated on intake are those who are going to be euthanized, like immediately, like they're very injured. Because remember, I said the worst thing that's going to happen is that vaccine's not going to work. You're not going to make them sicker. You're not going to make them worse. And that's a common misunderstanding, and it's something many private practitioners will still follow, because that's what we were taught in school, is you don't vaccinate them if they have a fever or if they're sick. But that's in like the land of a individually, privately owned pet, right? We're in a shelter where the risk is much higher, and so we have to do things differently. How are vaccinations being stored, handled? We want to mix them up only right before they're given. Want to be sure they're in a fridge where you're checking the temperature regularly to make sure it's not vacillating. Is everybody trained on how to give those vaccines? Sanitation practices. How many of you use rescue? Yes. That is great. It's my favorite thing. I was telling someone I have a gallon that I bought on Amazon just to use to clean my bathroom. I love it. That's what I use to clean my house. It is great stuff. Definitely worth it. I trust it completely. I've got kids. Kids are gross. You need rescue. What's the housing type? If you've got double-sided housing, are you using it properly, right? So guillotines should be up, or portals should be up all the time, except when it's time to clean. Then you shut it and you clean the side that's empty, open, move the animal over and clean the other side, and then open your guillotine. That allows hands-free cleaning, right? Cleaning is the dirtiest part of the work that we do with the animals, right? It is the biggest chance for spreading disease is during cleaning. So if you can do that without touching the animal, that is your best bet. Then what is the general biosecurity like in the shelter? So if you have a sick animal, do you have a space to isolate them? Do you have a place, maybe it's not a separate room with separate ventilation, like you don't have to be all that fancy. It might be that you have only one ward, one dog ward, and all the kennels are in the same space, and what isolation looks like there is maybe tape on the floor, maybe a shower curtain, maybe dogs, 3 kennels on one side, and then a buffer in between, and we do our best with what we've got, right? Depending on the disease, if you're dealing with something aerosolized like strep zoo, canine influenza, or distemper, you do need to have those animals moved out of the space. But with other things like parvo and kind of more general kennel cough, I don't worry as much. Foster is a great option. Foster to adopt is a really great option. And yes, we have shelters that adopt out dogs with distemper and they're doing it intentionally and with full disclosure to say, this dog was diagnosed with distemper, they are recovering, they need a couple more weeks, and they go home. Capacity for care, what's the intake, your annual intake, what's the number of animals you have on hand at any given time. Length of stay is really, really important. gonna speed through a little bit. A clean break, who knows what a clean break is? Who's heard of this idea of a clean break for outbreak management? Okay, so not a lot of you, so I will talk about it. What that means is that, let's see, we're gonna talk about, I keep talking about distemper. We'll talk about Strep zoo. A lot of people were interested in learning more about Strep zoo. It's a bacteria. We see that in shelters that are operating way beyond their capacity for care. It's a marker of poor husbandry, honestly. And so you often will not see it if things are going well. But a clean break is a way to continue to take in animals if you are a municipal shelter and maybe you can't say no and you have to take in animals, but you have sick animals that you're trying to treat. So you will develop a space in your shelter. It's okay. You'll develop a space in your shelter that you can isolate your sick animals, and maybe that's your whole adoption space. If you've got Strep zoo, potentially your whole dog population is affected. And so maybe you're using your typical isolation space, which might be smaller, as your clean break. So that isolation space would be completely cleared out. Any new animal comes in and goes into that space. They are not mixed with the sick population. Ideally, you have separate staff caring for them. If not, then you have staff that cares for your new animals. They change, well, they would need to change clothes from new to old, unless, maybe. Depends on your population of who's coming in. If you want to be safe, change your clothes, and then work with your sick animals. And then as your sick animals clear and move out, maybe you've got